Hi, I'm Dr. Veda. It's very nice to meet you. So welcome to our ear, nose, and throat clinic. Can you tell me what's bringing you in to see me today? Okay. All right, yeah. And how long has that been going on for, approximately? All right, and then on a scale of 1 to 10, how severe is that dizziness? Okay. So with what you're describing and the severity, I am going to do a quick hints exam before anything else, just to make sure that this isn't an emergency situation that we need to get you to the hospital for, okay? So I'll start by having you look right at my nose, and I'm going to gently move your head from side to side, but you just keep your eyes on my nose, okay? Okay, so I'm going to put my hands on your chin, look right at my nose, and I'm going to move your head to the right. Keep looking. Good. And I'm going to move your head back to the left. Just keep looking. Good. I'm going to go back to the right. Very good. And one more time back to the left. Okay, very good. Now I'm going to have you hold your head completely still. And with just your eyes, I'll have you look as far to the right as you can, okay? So keep your head still, and then as far to the right as you can. Good. Now as far to your left as you can. Okay, good. Just keep your head totally still. Now I'm going to put my hand on your chin just to keep you steady. And again, as far to the right, just your eyes. Very good. Now as far to the left as you can. Good. Now back to the right. Now back to the left. Okay, excellent. Now I'll have you look at my nose one more time, and I'm going to cover each of your eyes. So go ahead, look at my nose, and I'm going to cover your right eye. Okay. Now I'm going to cover your left eye. Good. Keep looking right at my nose. Cover your right eye again. And now your left eye. Okay, excellent. So hints exam looks totally fine. That's great. So I'm going to go ahead and ask you some questions about your symptoms, and then we'll go into an exam. So I know you gave me an estimate. Do you have a date or a guess of a date when the dizziness first began? Okay. And is this dizziness constant, or does it come and go? All right, yeah. So where it's coming and going, how often do you experience the dizziness? Okay, that's per day. Yeah. And when you have an episode, how long does it typically last? Gotcha. Now, in conjunction with the dizziness, do you experience any of the following symptoms? Lightheadedness. Okay. A swimming sensation in the head, or sort of like a rocking or fogginess. Okay. Any blackout spells or periods of time that you can't account for? Okay, that's good. Any loss of consciousness, even very brief? Yeah. Okay. Any objects spinning or turning around you when you know they're actually still? Any sensation that you're spinning or turning and that outside objects are stationary? Okay. Any loss of balance when you're walking? Yeah, okay. And does that happen frequently during the dizziness? That makes sense. Yeah, you try to sit down. Yeah. Now, you've noticed that you've had some loss of balance. Do you notice if you veer to the left or right in particular? Okay. Now, do changes in position tend to trigger the dizziness? Like if you get up suddenly, or if you move your head too fast? Yeah, sometimes. Yeah. Okay. And are you dizzy when you look up, such as if you're getting an item from the top shelf in your kitchen, if you're looking up at that item? Okay. And between the episodes, are you totally free of dizziness, or is it always kind of lingering and just gets worse sometimes? Yeah, so it's pretty constant, but it's just a lot worse during those episodes. Gotcha. Do you have headaches with your dizziness? Okay. And are headaches a typical thing for you, or is it because of the dizziness you think they're linked? All right. Do you get nauseated when you're dizzy? Yeah. You ever vomit, or is it just the nauseous? Okay. Yeah. Do you have trouble walking in the dark in particular? Yeah, the reason, so generally our vision can play a role in our balance as well. So if you have a fixed point that you're focusing on, like say you're trying to stand on one foot and there's a fixed point that you're focusing on, that can help. But when it's dark, we don't have that visual cue, so the dizziness can be more pronounced. Yeah, okay, that makes sense. Will anything stop your dizziness or make it better when it starts? Is there a way that you found that kind of alleviates it? Okay. That makes sense. So you kind of lay down in a dark room, wait for it to pass. Sounds like how people sometimes deal with migraines. Now, when you do that, how long does it usually take for the dizziness to start going away? Yeah. Okay. And are there things that seem to make it worse? Yeah, that makes sense. When you said that sudden movements make it worse, anything like that's gonna impact it for sure. And if you wanted to right now, not that you would want to, but would you be able to trigger a dizzy spell yourself by doing something like moving your head quickly, standing up too fast? Okay. And can you generally tell when the dizziness is about to start, or does it come on suddenly without any sign? Okay. Gotcha. Have you had any discharge from your ears that you've noticed? Any difficulty hearing at all? Okay. Does that seem to be in both ears, your right ear or your left ear? Sorry, your right ear or your left ear? Okay, both. Does your hearing seem to get worse with the dizziness, or do you have any noise in your ears? Okay, so hearing doesn't get worse. Noise in the ears, ringing, crackling. All right, gotcha. Does that seem to be in one ear or the other, or both? Both ears. Have you had tinnitus before, the ringing? As a kid? Okay. That can be so frustrating. Do you have any feeling of fullness or blockage in your ears, one or the other? Okay, we'll get a closer look in these after, but just take a look. Okay. Any pain in your ears? Okay. And does it feel like maybe there's water trapped in there? I know I compare it to that sensation. It doesn't necessarily mean there's actually water in there, but most people are familiar with it. So does it feel like that at all? Okay. And have you ever had a head injury? How about recently? Anything recently? All right. Back when you did have that head injury, I know it was quite a while ago, did you lose consciousness at all? Okay. For how long? Did you have an MRI at that time or anything? Okay. And have you been taking any medication for the dizziness? All right. Any history of heart trouble, stroke, thyroid disease, high blood pressure? Okay. Do you know what your most recent blood pressure reading was? Okay. Are you on medication for it? Yeah. And that seems to be helping. Good. Any diabetes? Migraines? Okay. What do you generally take if you get a migraine? Oh, okay. I actually really like that one. That's a good medication. And that seems to help? Good. Anxiety and panic attacks? Okay. And are you taking any medication for that? Okay. Have you seen a psychiatrist or talked to your general practitioner at all about that? Okay. Yeah, I understand. You have an appointment coming up, though. Excellent. Okay. Any kidney disease? Okay. Family history, but nothing for you. Good. Now, do you experience any of the following symptoms constantly or in episodes? So, headache. I know you've had that. Does it seem to be constant or episodic? Pressure in your head. None constant or episodes. Okay. Double vision. Yeah. And is that during your whole duration of the dizziness, or does that seem to be just occasional? Okay. Numbness and tingling in the face or extremities. So some people feel it in like the jaw, fingers. Okay. Any blindness or flashing lights? Right. Weakness in the arms and legs. Any clumsiness in your arms, legs, hands? Gotcha. Okay. Confusion or loss of consciousness at all? Okay. Any difficulty with speech? And difficulty swallowing? Okay, good. All right. So now we'll move into the more in-depth exam. Just gonna go ahead and grab a glove here. And I'm gonna start by taking a look at your ears. So I'll be palpating your ears a bit, just feeling around the outside. I'm gonna start with your right ear here. So I'm gonna go ahead, and this should not hurt. If you feel any pain, let me know. So I'm looking for any pain or tenderness. I'm just going to be touching gently and feeling for any abnormalities, okay? Okay. Start over here with your right ear. Okay. No pain there. Okay, good. And I'm just gonna press a little bit and just gently pull, okay? All right. Good. Okay. So I'm not seeing or feeling anything externally. And you haven't had any complaints about the external ear, so that makes sense. Okay. That seems good. Alright, now I'm going to do the same to the left ear. So just let me know if you feel any pain or tenderness. touching gently. Press around here. Okay. And I'm just going to pull back on the ear again. Okay. Nothing there either. Yeah, I'm not feeling or seeing anything externally on either ear, as expected. Okay, just touch here real quick. Okay, good. I'm gonna grab my otoscope here, and we'll take a look inside your ears. So I'm gonna start again on your right side, and I'm just gonna go in the ear with this. Okay, so I'm looking for any redness, swelling, abnormalities, lesions, anything in there. Okay. Just taking a look at the ear canal. I'm seeing a little bit of redness, a bit of swelling, maybe just a tiny bit though. Okay, I'm just gonna get a little further in, just get a better look at that eardrum. Oh, yeah. Okay. I'm gonna pull back on the ear just a tad to just get a really good look there. Alright. So I am seeing some swelling and redness of the eardrum. Potentially, it looks like maybe some fluid behind it, which may be an indicator of inner ear infection, which would explain the dizziness. Just go in here. Okay. Yeah. Alright. Yeah, I think, so what I'm seeing in the right ear so far, the ear canal itself, very little irritation, just a little bit. But the eardrum itself, I'm seeing a little bit of swelling, and it looks like some fluid behind it. So I'm gonna go ahead and look in the left ear now. Okay. Very similar situation in the ear canal over here. Minimal redness. Looks like maybe a little bit of irritation. Have you used Q-tips inside the ears at all, maybe to try to relieve some of that discomfort? Yeah, okay. So I think that might be where some of that irritation is coming from, just in the ear canal itself. No, I'm not gonna judge you or lecture you. Yeah, I would caution against using Q-tips in the ear, because we can cause damage, but you did not do that, thankfully. So I just caution against it in the future, but you're fine. Okay, I'm just gonna look at the eardrum a little bit. Pull back on your ear. Get a better look. Okay. Yeah, this looks like it might be, it seems to be bilateral, because I'm seeing similar over here. Eardrum appears to be a bit swollen, red. Fluid buildup behind it, I think. Yeah. Okay. That definitely doesn't look super comfortable. I understand what you're talking about. Okay. So, what I'm seeing, it looks like there's some fluid buildup behind both eardrums, indicative of a bilateral inner ear infection, which can cause the dizziness. So I think that's probably what we're dealing with, but we'll just look at a few more things here as well. So now I have a tuning fork, and I'm just going to strike this and put it above your head, and I want you to listen and see if it sounds like it is equal in both ears, okay? Okay, just bringing it down. Alright, so did that sound pretty equal volume in both ears? Okay, yeah. So basically what I'm doing by going down your line of symmetry and right in the center of your head, it should sound relatively equal in volume, assuming that you have even hearing in both ears, which sounds like you usually do. We're going to try one more time. Okay. Okay. Now, did the noise seem to travel correctly based on where I was moving it? Okay. Yeah, especially where it seems to be a bilateral infection. It can cause varying degrees of hearing difficulty in each ear, but where it's happening in both ears, it makes sense that it would be somewhat equal, so that seems about right. Now I'm going to go ahead and put the tuning fork behind your ear, so I'm going to start up here, move it behind the ear, and we'll make sure that the sound is traveling correctly and that you still hear it when it's behind the ear, okay? Nope, not a good one. There we go. Good, okay. And now we'll do your other side. Alright, just bring it around behind. Okay. Good. And the sounds seem to move correctly. Okay, yeah. Now, when I move it behind your ear, you didn't have any difficulty hearing it back there. It seemed to sound as it should. Okay. I'm going to say a few numbers in your ear. I want you to repeat them back to me, okay? And I am going to be moving around behind as well. 56, 14, 12. Can you repeat those numbers back? Excellent. Then this side, 32, 45, 19. Okay, very good. Just making sure that we're not having particular hearing loss or hearing issues when moving in different areas of the head. Okay. Now, get you a different tip. And we're going to look in your nose. So I'll have you just tilt your head up a bit for me. And I'm going to come in here. I'm just looking in your right nostril first. Just looking for anything in your nasal passage. Any signs of infection in here. Okay. And the other side. Coming into your left nostril now. Okay. Your nose looks good. I'm not seeing anything wrong with the nasal passages. Okay. Good there. And you haven't noticed any increased stuffiness, running nose, sneezing. Okay, good. I'm going to go ahead and palpate around here, looking for any issues with your sinuses. So let me know if anything is painful or tender. I'm just looking for any swelling, any discomfort that you might have. Just touch right there. Okay. Other side here. Now, you know your own face. Have you noticed any swelling? Okay. I'm going to touch down the nose itself. Right. And the sides. to the nostrils, and if I just pinch gently like this, no pain. Okay. Just come up again, your face. Okay. So I'm not seeing any signs of any sort of nasal issue or infection here. All right. Good. Ever have any trouble breathing out of your nose? Okay, yeah, so just when you're sick though, not in general. Gotcha. Do you generally breathe through your nose or your mouth at night? Okay. Good. Now have you open your mouth for me and go ah, stick your tongue out and ah. Okay. Just looking at your throat and around your mouth. Keep your tongue out for me and go ah one more time. Good. Okay. Yeah, I'm looking at the back of your throat. Tonsils look good. Throat looks good. Not seeing any redness. Not sore at all in your throat, right? Okay, good. No coughing. Okay. Good. And just looking around the mouth. Just keep your tongue out. I know. Not the most comfortable. Okay. Good. You can relax for a minute. So that looks fine. Now I'm going to have you open your mouth again, and I'm just going to have you move your tongue all the way to the right. Stick your tongue out, move to the right. Okay, other side. Okay. And now, just grab a piece of gauze here. I'm just going to gently grab your tongue and move it around, okay? So if you could stick your tongue out for me. Just going to look in here. Okay. Good. Underneath. You have a very clean mouth. Okay. Perfect. So everything looks good in there. No pain, tenderness, anything when I moved your tongue. Good. Alright. The last thing I want to go ahead and do is palpate your lymph nodes on your neck. Just again feeling for any swelling. No stiffness in the neck, tenderness. Okay. Good. How's this feel? How about over here? And if I push down right here, is this okay? Okay, and how about here? Good. Yeah, I'm not feeling any swelling in your lymph nodes, so that is good. Just gonna press on a few places here. Let me know if anything is tender, uncomfortable. Here a little bit. Good. Okay. Very good. All right. So that seems fine as well. Now, based on what I'm seeing and your symptoms, this does look like a pretty standard inner ear infection. Both ears, so bilateral inner ear infection. Now, this is very good news, easy to treat, and you should be able to find relief very quickly. I'm going to go ahead and prescribe you an antibiotic to pick up at your local pharmacy. What pharmacy do you typically use? Okay. Main Street? Yeah, okay. And do you have any any allergies to different medications? Sulfa, yeah, okay. You get hives, anaphylaxis. Hives. We won't give you a sulfa antibiotic then. Right. So that is going to be at your pharmacy. Just an antibiotic that should clear everything up within 2 weeks. So you will take that for 2 weeks and it should totally get rid of the infection. In the meantime, you can take an over-the-counter antihistamine to find relief from the dizziness. That should help quite a bit. So you could use Zyrtec, a generic, any antihistamine of your choice. That should help with the dizziness in the meantime. Now, as you're on the antibiotic and it starts to clear up, it should get better and better over the 2 weeks, so it shouldn't take the full 2 weeks. Really should be feeling a lot better even in just a couple days, okay? But if you still find after 2 weeks that your dizziness is persisting and those other symptoms like the ear issues, the fullness, any discomfort in the ears, I do want you to come back and see me, okay? So this should take care of it. It should knock it out in 2 weeks. And if there's issues beyond that point, I do want you to come back. Do you have any questions for me? Oh yeah, no, it's just it's 1 pill a day, the antibiotic, just 1 pill a day for 2 full weeks. But like I said, it should not take the 2 full weeks for you to start feeling relief, especially if you put the antihistamine on top of it. Yeah. Oh, you're so welcome. Yeah, of course. So I will walk you up to the front desk and we can settle up and everything. You don't need to schedule another appointment. But if, like I said, if you do still feel the dizziness or any issues after those 2 weeks, make sure you come back and see me, okay? All right, perfect. Well, we'll get you out of here and get you feeling much better.